busy. But I want to thank you for joining me this morning for this one-on-one live with action. And so the reason I wanted to, and shout out to your team for helping to make this happen, I wanted to talk with you because there's a disconnect in the media, especially in the African-American community and millennials. And so, recently on the 25th, and the Tribune just did a headline yesterday that said that, that big house party was because of the disconnect with the media. And we know that millennials and a lot of African-American community are not watching the daily briefings. I do, every day, and I thank you for that. So thank you for joining us just to shed some light on it.
Of course, and I appreciate that. Let me just say that it's clear to me, because I see all the facts, that we can't have people gathering in large groups, in a small space, because what we found out is that even if you don't feel well, turns out the days before you might show symptoms, you actually could have COVID-19 coronavirus. Mm-hmm. And so when you go to a party and you're feeling just fine and everybody else feels fine, somebody there, you or somebody else there, could easily have the virus and give it to somebody else. And when nobody's wearing any face masks, or very few, and people are contacting each other and touching each other, even if you shake hands with somebody and then touch your own face, you have the ability to end up getting coronavirus. And so that's why we've been so serious about people staying home and wearing face masks and washing their hands and not gathering in large groups, because it turns out that for every one person that gets this, multiple other people catch it from the one person, and each of those multiple people give it to multiple others. And the result of that is that you get a widespread infection. Mm-hmm. Now, let me tell you what happens when people get infected. It's true that about 80% of people recover after having, feeling terrible for a few weeks, but they recover 80%. But then there are about 19% that have even more serious symptoms to the point where they struggle breathing. They might need to go into the hospital, and many people are going into the hospital, thousands. And then 1% of the people who get this die. So you could, if you put yourself at risk and you put your family at risk by, catching it from somebody else or having it and just ignoring it, or thinking you don't have it and then spreading it around. Right. I mean, 1 out of every 100 people that you come in contact with could end up dying. And so it's very important for people to pay attention to this. And I know it's hard to believe all this because it's this invisible infection. It's this invisible enemy that's around us. But I need people to understand that we're working to defeat this thing, and here's how we're doing it. First of all, if people will make sure they're socially distancing, they're not gathering in groups of more than 10, if people will wear masks just for a little while longer, what we're doing is we're giving the hospitals and the healthcare providers the ability to manage all the people who are sick. That's number one. Because if we don't do that, then when you get sick, there won't be a place for you at the hospital. I mean, you may not be able to get treated, and we don't want that. So that's one thing. And the other is we're giving the researchers time to come up with a treatment and a vaccine so that we don't have to live like this forever. Yeah. So that's what we're doing right now, and people need to have a little bit of patience. And I promise you we're going to get through this, but it's going to be a little different for a little while now. And people need to wear masks, wash their hands, follow the rules here.
Now, what we appreciate about you, and it's going to the community, you're listening to the healthcare professionals. You're listening to the experts and not making decisions out of your gut or what you believe may be right. Now, tomorrow starts the new mandate and the extension of the stay-home order. Now, can you kind of explain what that entails? Because I've been seeing memes going around the internet saying the bars are opening, we're going out, or the weather's going to be 70 degrees. And so can you just explain how that is going to work?
Sure. So it's really a continuation of our stay-at-home order, but we made some adjustments to it to make it a little bit easier. It's summertime. We do want people to try to get outside, but no, the mayor has closed down the lakefront, so people should not go to the lakefront. But what we have said is we're opening the state parks. We're opening golf courses, again, with certain rules, because we don't want people gathering in large groups again.
Right.
But opening the state parks, people can go hiking and biking and fishing and whatever they want to do, and golf courses. And then, we're allowing people to go get elective surgeries. That doesn't sound like a lot of fun, but if you've got some kind of sickness and you need to get surgery for it, a healthcare issue, maybe you've got a knee that needs replacing or something else. That hasn't been allowed the last 6 or 7 weeks because we've been dealing with this virus and we didn't want to fill up the hospital beds. Well, we didn't know how many people would end up in the hospital. So those are some of the adjustments. Retail, you can't go into retail stores, but they can come out and deliver things to your car if you call ahead or order online and just say, I'm going to come pick it up. They'll bring it out to your car, take your credit card or your cash or whatever, and they can do it right there on the curb. And then we also have deliveries for those retail stores. So that's not restaurants. That's also, with takeout and delivery, but also now just regular retail, clothing stores and things like that. Right. And again, it sounds like, everything's still very buttoned up, but we're slowly but surely opening things up as we're able to manage this coronavirus. And again, if we don't do that, if people go to parties or if they decide they're just going to ignore wearing masks, more people are going to get sick, and then we're going to have to shut things down even more.
Now, I'm glad you mentioned the mask, because in the new extension starting tomorrow, to come out, everyone has to have a mask on, correct?
Yeah, a face covering. It doesn't have to be a surgical mask or an official N95 mask or anything like that, but wearing a scarf or wearing a t-shirt. I've seen people take a t-shirt and you could just tie it up in the back of your head, and it's around your face. That's good enough. And let me tell you why that's so important. It isn't so much that your mask is protecting you, although it does a little bit, but it's everybody that's wearing a mask is actually protecting everybody else. So because this virus is most often transmitted when people they sneeze or they cough or they're just speaking. Sometimes we all know when you speak, sometimes a little something comes out of your mouth while you're speaking. And if you're wearing a mask, that can't happen, right? It'll stay in the mask or the face covering. So now, again, you don't have to spend any money on a face covering. You could get a t-shirt, make it into a face covering. Some people think it's turned into a fashion statement, which is fine if you want to wear something that has a picture on it or just a certain color. That's all great. But it is really important that when you go out in public, that you wear a mask. Take a mask with you. And when you run into people, if you're trying to just go out alone or with your spouse or somebody you live with, it's fine walking along, but when you run into a group of people, wear pull that mask up, that face covering up to protect everybody around you. It's the respectful thing to do.
Right. Now, what criteria must be met for you to deem Illinois safe to lift the quarantine?
It's a great question. So I'm tracking this very closely because I want people to get back to work and back to school and having a great summer. And so I'm looking for all the markers of when can we loosen things up, So here are the things that we need to do. First of all, we need everybody to respect this social distancing, keeping 6 feet from each other, wearing face coverings and so on. That's very important. That's going to continue no matter what. Even if we open things up, we got to make sure people are doing that. Second, we're increasing the amount of testing that's available, and particularly in the Black community, where we know the Black community is more vulnerable to coronavirus because there are more pre-existing conditions. There's a higher incidence of heart disease and diabetes and other conditions in the Black community. And those are the things that when you put them together with coronavirus, that's when people get seriously ill.
Yes.
So we want to protect everybody in the Black community. And so what we're trying to do is do more testing. We want to make sure that if we find out that somebody tests positive, we're going to ask them to go home, self-isolate for at least till they recover, really, till they recover. We want them to feel better. But if you test positive, so you need to go home. It'll, be for most people, it'll be just like having the flu, maybe a little bit worse. But for some people, it might be more serious than that. And we're going to help monitor people who go home who have it, so that we're checking in with you to see how you're doing. Make sure you go to the hospital if you need to.
Mm-hmm.
But it's also, so we need to do a lot of testing. And so we've opened a lot of testing locations in the Black communities across the state. Not just the west and south sides of Chicago, and of course the north side too, but also in places like East St. Louis, where there's a large Black community that needs to be protected.
Oh yeah.
So we want to know how many people have it, who has it. We want to isolate them. Also, the people who have it, we need to know who their contacts are, people they came in contact with in the last few days before they were tested positive, so we can contact those people and let them know, hey, you've been exposed to somebody who has coronavirus, so you should take some time off, stay at home for 14 days is what we ask people, 14 days, because we don't want you to spread it to other people. So those are some of the things. And then one last thing is, it's always been known to me, and I think to you, Marcial, that that healthcare availability and the quality of healthcare for people in the Black community clearly is not as good as it is in other communities and other areas. And that's been something I think we've known for a long time, and I've been trying to fix since I became governor. But this virus has really highlighted those problems. We're working really hard to make sure that we have a lot of healthcare availability for the Black community during this pandemic, because it hits the Black community even to an even greater extent than it does others. And then, of course, as we get past coronavirus, we need to continue to build up healthcare availability for everybody, but specifically for those who are most vulnerable.
Definitely. So when do you expect to flatten the curve? When do you believe that it'll be flattening? Illinois may be back to business as usual.
So the key here is, these are the markers of, when do we get there? We need to get to a peak, like where we're not increasing the number of people going into the hospital anymore. We're still increasing now the number of people getting sick from coronavirus and going in the hospital. So we need that to flatten. And then we need to have it go down the other side of the mountain, so that we have a decreasing number of people going to the hospital with coronavirus. So that's one indicator. A second thing is we need more testing. We just got to keep building it. That's something under our control. We can build up the amount of testing. It's hard because the president has kind of created a free-for-all out in the market. He's not helping. The federal government is not being very helpful as we're trying to test more people.
Right.
But we're doing it. We've doubled the amount of testing in Illinois just in the last couple of weeks, and I'm going to continue to build that up. We're the 5th most per capita testing in the entire country now. We used to be 32nd, so we're climbing the ratings here. But so more testing, and then we need more tracing, so we can know everybody that got exposed. They can know, they need to go home, they need to take it easy, they know where to get a doctor, and so on. So those are all things that come together to indicate, okay, now we can start to open things up because we've got the right amount of testing, and we're keeping people who are sick away from people that aren't sick. So those are some of the things that are indicators. It's summer. People want to go outside. I understand that. We got to be careful, though, because if people just decide on their own, hey, we're going to have a party, or hey, we're going to go, on the lakefront and, have a big gathering, or let's all have, let's have 50 people on a basketball court or around it, or going to a baseball game even right now. Can't do it because we're going to spread the virus, and we're going to go back to a situation where we have too many people going in the hospital and ultimately too many people dying.
Now, you touched on the federal government, and in an interview on April 15th you had with CNN, you stated that you gave up on, federal assistance because you've gotten very little help from the federal government. Since then, though, from April 15th to now, has the state of Illinois received any additional support and aid from the federal government?
Well, I'm glad you asked that, because when I said that on CNN, what I was really trying to say was that a lot of promises were made and then they weren't delivered. And so that's what I really meant, And so all I was trying to say was, when the promise gets made now by the federal government, I'm not counting on it. I hope it happens. But now I've learned that sometimes they make promises and they don't deliver. So that's all. But I have to say, the federal government has done a lot of things for us.
Okay.
The Army Corps of Engineers helped to build out, alternate care sites. So in case we have too many people in the hospitals, we need to care for more people, we have places for them to go. They helped us out. I just got a call yesterday from the guy who runs the testing for the federal government.
Mm-hmm.
And he told me that they're going to deliver to Illinois 600,000 swabs, which is a very important part of the test.
Oh, yeah.
And there's a worldwide shortage of swabs, so 600,000 swabs would be a big deal. And so I'm hoping that that's going to happen. I'm waiting. He said the first week of May we'll see the first shipment. So he's an admiral. I don't know. I tend to believe him. I hope he'll deliver on that. I think he will. But we've gotten a lot from the federal government. It's just not nearly what we were told we were going to get. And there are things like masks and gowns and goggles and things to protect our first responders and our healthcare workers. And we got, a small sliver of what we've asked for.
Yeah. Now, I'm glad. So during this COVID-19 pandemic, the African-American community has suffered in several ways, and low income, middle class suffered, with the disease, but also financially, economically, and beyond social services. Do you have an economic plan for redevelopment once this is over?
Yes. So this has been a terrible burden on everybody. This is an invisible enemy, and it has devastated people's lives and it's devastated people's livelihoods.
Mm-hmm.
And so we've got to rebuild. There's no question about it. Now, the federal government has to provide more money for the state and for local governments and for people. And so that's part of what's necessary for us to rebuild. But also the state of Illinois, we created a program shortly after this virus started really hurting people economically. We started a program to provide grants for small businesses, not a loan, but a grant, because a lot of businesses have had to close and their employees aren't working and the business owner isn't making any money. And so we provided grants from our Department of Commerce for small businesses who apply for those grants. That's one thing that we've done. We're trying to expand that program. Another is that we, for small businesses in particular, restaurants and bars, most of them are able to put off paying their sales taxes that they were getting from February. Remember, usually, you have a month, you have a good month and you pay sales taxes in the next month. Well, by the next month, things were closed down and people couldn't, use the money they were making in that month to pay the taxes from the prior month. So we allowed people to defer paying their taxes for several months. And the same thing with income taxes. People did not have to file their state income taxes in April. They can file them in July. So these are some of the things that we've tried to do. And then we've tried to provide supports for people in communities where, people, particularly the working, people who are poor and who are working, people who are poor and not working. So we have unemployment insurance for people who, were laid off. And there's an additional amount for many people get $600 more than they usually would because the federal government provided that. So that money is helping people out during this difficult time. And then we're trying to expand healthcare availability, not just for coronavirus, but just so people, who are out of work have the ability to get healthcare during this time. Because guess what? People get sick from normal things, even without the coronavirus. Those are some of the things. And of course, then we've got people who are truly poor who need, help with, they need pantries, food pantries. They need help with shelter. There are a lot of homeless people we know, even before coronavirus. And those people we need to make sure they stay healthy too.
Right.
And so we've gone and rented a bunch of hotels and motels to provide shelter for those folks, as well as for healthcare workers who, it's hard for them to go back and forth. Maybe they live very far away from where they work. So those are some of the things that we're trying to do for communities across the state. The best thing we can do, of course, is if we can get past this peak, let's get people back to work and back to their, a little bit of more normal life.
I'm glad and I appreciate. I always enjoy talking to you, especially when it's just running into you in the community, because you know how to. You have a way with words. You have the answers before I can ask the question, and you answered one of my questions about the homeless community. But I want to go back to unemployment. Now, CBS Chicago reported that a little over 18,000 residents are dealing with not receiving unemployment due to penalty weeks, causing them to not get paid as much as 26 weeks. So what is local legislative doing in regards to that? So, and I personally got a story of that, and I took a few questions from the community that they asked me to ask, but.
So thanks for that question. And here's what I can tell you, that many of the people that they interviewed on CBS 2 have had some difficulty in the past where they applied for unemployment and maybe gave some information that wasn't totally accurate, or they got paid more than they were supposed to get paid for some reason or another when they were on unemployment at some previous moment. And there's a law in place that says, and it's a federal law, that says that if you break the rules, that there's a penalty time period during which you're not allowed to get unemployment benefits. And so I know that's been a real hardship for people who have had that experience. And it's something that, unfortunately, because it's a federal rule, it's not something that we can really fix at the state level. There are other supports. I want to make sure people know there's a rent support program through the Department of Human Services. If you're having trouble paying your rent, we have a fund that can help you with your rent payments. We have food pantries and other Meals on Wheels and other programs that are delivering or offering free food for people during this time period. And then we've got the Illinois COVID Response Fund, which people can go find online. And I think it's illinoiscovidresponsefund.org, which is a nonprofit that got created. Actually, I asked my sister, who is the former Commerce Secretary for President Obama, to lead it along with a number of other people. And that fund, which has raised more than $30 million, is providing support to local organizations that are lifting up people in communities who, may have been laid off and may not have a job and may not be able to access unemployment benefits. So it is, I know, a difficult time for a lot of people. And if you can't get that regular check from unemployment, it makes it all that much more difficult. We're working hard to provide more supports for people, though.
Well, Governor Pritzker, I know you have to go. We had a few more questions, but I appreciate you taking time out to address some of the questions that we had. And we hope that we can do this again in the future. And we just want to make sure that the communities are getting and hearing from you. I know they can't see you during this pandemic right now, but if they can see you virtually, I know they're excited about that.
Well, you're making it possible, Marcial. For me to at least be able to communicate to people and for people to be able to see me. So I very much appreciate that. And, it's always great to see you. And I just want people to know that I'm working very hard to make sure that we're doing all the right things so we can get past this thing as fast as possible. And I just hope that people will continue to follow the rules that we've set out here for just a little while longer. This new stay-at-home rule is 30 days, and if I can lift it earlier, I will. But in the meantime, we want to make sure we get past this peak and get people healthy and make sure they're safe. So thanks again, Marcial. Great to see you.
Thank you. And I send love from Malcolm Crawford, Charmaine Riquette, and MacArthur. When this is open back up, they say you got to come and join us for breakfast so we can all have some Parker House sausages.
I've enjoyed that many times with you, and I appreciate that.
All right. Thank you, Governor. You enjoy your day, and I'll be watching the press briefing today.
Thank you. You too. Have a good one.
All right.